Today we'll be discussing Language Assistance Services at the Health Plan of San Mateo, or HPSM. Thank you for joining. We'll cover everything you need to know about provider rights and responsibilities, the types of services we provide, how to access those services, and some pro tips for success. HPSM's Culturally and Linguistically Appropriate Services, or CLAS, program complies with Title VI of the Civil Rights Act of 1964. There are three primary requirements for providers when working with members who have limited English proficiency. HPSM's first requirement for providers is to offer members with limited English proficiency the opportunity to work with a qualified interpreter. During any visit with a limited English proficiency or sensory impaired member, providers should offer access to phone or video interpreters more than once at every point of contact. Providers should let members know HPSM offers interpreter services at no cost. We'll share more information on how to access these services shortly. Members cannot be required to use their own phone to access interpreter services, nor can they be asked by the provider to use a friend or family member to interpret their visit. The second requirement for HPSM providers is to document the member's language preferences in their medical record. This should include any language services that were offered, the date that services were offered, and whether language services were declined. Finally, the provider must maintain a list of bilingual capabilities of available practitioners and staff. Information to keep on file should include demonstration of proficiency in languages other than English, self-assessment of language proficiency, and number of years working as a qualified medical interpreter. Inform HPSM provider services of any changes to the language proficiencies of staff by responding to the Provider Directory Information Verification Change Form sent quarterly by HPSM. Now we'll share more about how HPSM providers can deliver quality service even if they do not speak the same language as the member. HPSM offers free phone and video-based interpreter services. In-person interpretation is also available for American Sign Language services and can be arranged by appointment. HPSM partners with Certified Languages International to offer telephone interpreting services to HPSM members in more than 230 languages. All interpreter services are provided by professionally trained and certified interpreters. This service is available to HPSM providers and their office staff 24 hours a day, 7 days a week. To use a telephone interpreter, dial 1-800-CALL-CLI or 225-5254. Provide the following information to the CLI operator when prompted. HPSM's provider access code 64095, the language the provider needs for interpreting services, the provider office name, the HPSM member ID for the patient, and the HPSM member's date of birth. Video interpreters can help you communicate better with members who have limited English proficiency or require American Sign Language assistance. To access video interpretation, go to hpsm.cli-video.com. Use the code 64095 HPSM to log in. We also have a tutorial video on how to use video interpreter services, which you can access at hpsm.org/provider/resources/language-services. Due to the COVID-19 global health crisis, in-person interpreters are available only for American Sign Language. To request an in-person interpreter, please complete the Request for Sign Language Interpreter form, which can be found at hpsm.org/provider/resources/language-services. Email or fax this form at least 5 business days prior to the date of the appointment. Here are some practices to help you deliver high-quality language services to HPSM members. Do learn how to work with an interpreter. Do continue to explore your own biases to improve care. Learning about other cultures and improving knowledge about cultural competency is a lifelong journey. Continue to provide patient-centered care to members of all races, ethnicities, and linguistics in accordance with state and federal law and company policy. HPSM provides an annual training for providers to continue building upon their knowledge around cultural competency and humility. Please ensure your communications preferences are accurate to avoid missing invitations to important webinars and trainings. Finally, it is the provider's responsibility to ensure clear communication with the member, not the members. Members who do not receive high-quality treatment due to a language barrier are entitled to file a grievance against their provider. HPSM providers should familiarize themselves with HPSM's grievance and appeals process by visiting hpsm.org and reviewing HPSM's provider manual. Want to learn more? Please visit us online at hpsm.org/provider/resources/language services. You can also send us questions, concerns, or request an interpreter by emailing interpreters@hpsm.org. Thank you for all you do for our community.